How important is participant recruitment in clinical trials? Participant recruitment is crucial to the success of a clinical trial. It can also be one of the most challenging and time-consuming aspects, but also the most expensive. As a site investigator, it's your responsibility to recognize and address those challenges in an ethical way. Participant recruitment involves identifying and enrolling persons who match key criteria and agree to participate in the study. Participant recruitment is the process that happens up to and including when the person signs the informed consent form. Once a person is recruited, they become a participant and can be screened for enrollment. A participant is enrolled once they have been recruited, screened, and meet all the eligibility criteria. Enrolled participants are then assigned to an intervention. Treatment may or may not be randomized depending on the trial design. Participant retention relates to the number of enrolled participants who complete a clinical trial. Both participant recruitment and retention are bottlenecks in clinical research that can lead to costly delays. Participant recruitment and enrollment is a multi-step process. Let's take a look at each of the steps a person goes through when participating in a clinical trial. Picture participant enrollment as a funnel. The widest part at the top represents the total number of potential participants in the population. The goal of enrollment is to recruit and retain as many eligible participants as possible from the top of the funnel to the bottom. Step 1. Potential participant pool. The potential participant pool is comprised of those individuals who may be eligible for participation based on certain inclusion and exclusion criteria within the study protocol. This pool represents the broader population from which researchers can recruit participants for their studies. Researchers routinely overestimate the number of participants available for enrollment. The size of the potential participant pool can vary greatly depending on the study's requirements. For some studies, especially those focusing on rare conditions, the pool may be quite small. Ideally, the pool should be diverse and representative of the population that the study aims to benefit. This helps ensure that the results are generalizable. Step 2. Site intake. As a PI, you will work with the sponsor and your clinical research coordinator to try to identify as many potential participants as possible. Potential participants can be identified from various sources, including patient registries, clinical databases, such as electronic medical records, physician referrals, community outreach, for example, patient organizations, clinical trial recruitment companies, and online platforms. These strategies need to be approved by your REB and sponsor. If a potential participant is not eligible for a clinical trial at your site, you or their treating physician may wish to help them find a suitable clinical trial at another site. More than half of the time, a clinical trial is not locally available. Step 3. Pre-screening. Pre-screening activities are conducted before the informed consent process and may involve a general overview of the study and pre-screening questionnaire. Pre-screening questions are based on the study's inclusion and exclusion criteria. Your aim here is to determine if a potential participant appears eligible for participation and therefore whether it is worthwhile for them to go through the entire screening process that will follow. Eligibility criteria typically include factors such as age, gender, medical condition, treatment history, and other relevant characteristics. Step 4. Informed consent process. Potential participants must provide informed consent before starting any medical screening. At this step, you meet with potential participants to discuss all the information they need to make a decision to participate in the trial or not, such as study purpose, treatment details, potential risks and benefits, and that they can stop participating at any time for any reason. Informed consent is more than just a signature on a page. You must give the potential participant the opportunity to ask clarifying questions and give them as much time as needed to make a voluntary choice. A participant is recruited once they have provided informed consent. You will learn more about informed consent in a subsequent course. Step 5. Screening. Once a participant has given informed consent, you, as the PI, are responsible for evaluating if they are eligible for the trial based on more in-depth inclusion/exclusion criteria. Screening tests may include a physical exam, for example, blood pressure, medical history, prior treatment response, laboratory tests, for example, blood work, and diagnostic tests, for example, imaging or biopsy. Eligibility criteria are strict to keep the participants safe and allow researchers to draw accurate conclusions about the efficacy of the drug or device. Screen failures happen when pre-screened potential participants do not pass screening tests. If screen failure rates are high, you may need to adjust pre-screening activities. Not all participants you screen will be eligible. This can be devastating for some patients. If a participant is eligible, you as the PI or delegated staff can discuss and offer the opportunity to participate in your clinical trial. Ultimately, it is the patient's decision whether to participate in the trial or pursue standard of care treatment. Once they agree to participate, they are officially enrolled in the clinical trial. Step 6. Intervention assignment. Once a participant is enrolled, they are assigned to an intervention. The intervention may or may not be randomized depending on the study protocol. Randomized studies usually are blinded to prevent bias, which can affect the results of the study. Bias can occur when a participant or researcher knows which group a participant is in. In a single-blinded trial, typically the participant does not know to which group they belong. In a double-blinded trial, often both the participant and you, the PI, do not know the group assignment. In a triple-blinded trial, most commonly the participants, PI, and data analysts are all blinded. In an open-label trial, no blinding is used, and all parties are aware of the treatment groups. Lastly, participant retention and trial completion. Participant retention describes the number of enrolled participants who complete a clinical trial. Alarmingly, up to 30% of participants will drop out before completing a clinical trial. Top reasons for discontinuing include side effects, study site location, poor communication, study burden, and lack of virtual option. Your job is to make every effort to remove as many of these challenges as possible.